Hi, this is Harry from Enrich Physio, and I'm here today to talk to you about a few exercises that might help you with the front of your knee pain. Now, the front of your knee pain is something that's usually associated to a condition that we call as a patellofemoral dysfunction, or a dysfunction happening or an irritation happening between the kneecap and the knee joint in itself. Now, such problems are usually associated to poor lower limb biomechanics or poor lower body biomechanics, and do often need exercises to correct your hip and knee muscle strength as well as flexibility. So let me just help you with a few exercises that you might find handy. So let's begin. So for my first exercise, I usually get two towel rolls wrapped one inside the other, or maybe get a foam roller. Alright, all we do with that foam roller is I sit on a bed on the floor, it does not really matter, and I just slide that thing under my knee. It's just slightly above the knee, just so that your knee or your leg feels free to move. And all we're trying to do while we're sitting there is we just try to kick the leg straight up and down. Ensure that you go through the whole range of motion. Feel free to lie down if you like, feel free to sit. The choice is yours, but all we're interested in is that end range of knee extension. So I'm looking at about a lot or a set of 15 repetitions, and give yourself about a 2 or 3 second hold at the top. So for the second exercise, I'm going to have a lie down onto my back. And having a lie down onto my back, I'm going to kick my legs straight up as if imagining I'm trying to kick a footy. However, the foot positioning or the leg positioning is slightly different as to kicking a footy. Please have a look. So all I do is have a lie down onto my back, turn my foot out, not in, okay? It's turning the foot out, maintain the knee straight, and all I'm trying to do is kick the leg straight up. Hold it there for 3 seconds. You feel some tension on the inner side of your thigh. Eh? Hold it for 3, 2, 1 and bring it down. Up you go again. 3, 2, 1 and down. I hope you've noticed that the foot does not come back in. It's constantly turned out. Okay? Now, the third exercise is primarily aimed at a hip dysfunction that associates itself with the problem. Often one might find that the buttock on the problematic side does not effectively work. Hence, this drill might help you activate your buttocks and probably help you with your knee pain. So all we do is we have a lie down onto our back, have our knees bent. Ensure that your bent knees don't stick together or they don't fan out. Yeah? They're just slightly apart, maybe shoulder width apart. Your hands are besides your body here. And all you're trying to do is try and engage those buttocks, try and clench those buttocks while you're lying down and thrust your hips off the bed. Hold it there for a couple of seconds, bring it down. Again, engage, lift, 1, 2, hold, bring it down. So, with these 3 exercises that I showed you, feel free to perform about a set of 15 repetitions with the preferred or with the recommended holds that I actually mentioned off as we went. And as weeks progress, maybe every week, try and add another set. Get to a point where you could do about 3 sets of 15, then maybe start again and go 1 set of 20 and then start doing 2 sets of 20, but try and have some weekly progressions. Try and do these exercises daily. When we're done with all of these exercises, I want you to just finish it off with one final drill, which is a stretch to try and get this muscle stretched, which usually goes tight. This is how you go about. I'm probably going to ask you to now have a lie down onto your tummy. Alright? And with your problematic knee, try and bend that knee and grab your ankle on the affected side. Go flat all the way. And all I'm trying to do is get that knee or the heel close to the same side buttock. And all I do is is I try and hold that position for about 20 seconds. Okay? Go by the clock, just don't count 20. And once you're done, slowly let go. Alright? This stretch needs to be repeated for about 3 to 4 repetitions, but at the end of the 3 exercises, not in the beginning. So I hope these exercises that I helped you with really help you with your knee pain. If they don't, feel free to give us a call at Enrich Physio, and we might be able to, one of my qualified physios, be able to help you with your problem and help you return to sport, help you return to doing whatever you want with no pain. Alright, thank you.